Now and new this morning, an in-depth look at a growing trend of people and what they're doing when they get sick. More 911 calls are being made for things like a sore throat and a fever. ABC 15's Brian McElhatton is actually live at a Mesa Fire station this morning to show us how the city is changing the way it's doing business in response to those calls. Brian, good morning. Lots of non-emergency calls, and they can be costly.
Yeah, this is unbelievable. You know, the fire department, 911, gets so many calls for things even like the flu. These are from people who have lost their jobs or who've never been able to find work and don't have health care, so they rely on the city as sort of a safety net. And in the past, when you call for flu symptoms, a fire engine has to come out, a four-man crew that costs thousands of dollars per each run. All the men on this truck, all the gasoline, the diesel that fills this truck up. But the Mesa Fire Department has purchased these vehicles. They kind of look like an ambulance on the outside, but on the inside, they look more like a clinic, like an exam room, because that's exactly what they are. This is a TRV, a transitional response vehicle. Forrest Smith is with us with the Mesa Fire Department. And how does this vehicle kind of change the way you do business because of these 911 calls, these non-emergency calls?
Well, good morning, Brian. Yeah, what we're trying to do here in the fire department is to match the call type with the response. And so our idea in doing this is to certainly keep our four-person crews in service for those cardiac arrest drowning calls, which we need 4 people for. But again, as you said, we can have these units respond on some of the less emergent calls. That way we keep those trucks in service. Allows us to be more efficient and still give a great level of delivery of service.
And we're talking about now, but it looks like a doctor's office. There's the oxygen, the water on the wall in here, and this is almost like an exam table of sorts. You're talking about putting physician's assistants on these trucks to actually administer medication, write prescriptions in the field.
Right, there's a plan down the line for us to be able to test this program where we could treat people back here. We're not necessarily going to transport here, but it allows us to create sort of a mobile examining room. And so that's some of the plans down the line. And again, the idea is to be innovative and be efficient. That way we can still provide that high level of service to our community.
Well, Connie, and truly an economic sign of the times, a fire department, which we think about fighting fires, now hiring physician's assistants working on out of these trucks to help people who don't have jobs that rely on the fire department for medical care.
Yeah, times are definitely changing. Thank you, Brian. We appreciate the update there from what's happening behind the scenes.